or crowns, and I help sometimes with um, sending patients to my root canal specialist. Sometimes they require some help in the surgical approach
Mhm.
of a root canal that is almost never needed. But basically, what I want to give to our patients is the possibility of receiving all the treatments in the same office. So that's where we're at. That's what we work on every day. So yes, the one finished was for placing some implants on a patient.
How can you tell me how much you charge for an implant, or what is a typical cost for an implant?
I charge $900 for um, the implant itself. That is, let's call it the artificial root. I am aware I am more expensive than most dentists, but what I can offer for that is treatment with a lifetime guarantee made by a certified specialist in implants, and well, trying to use the best brands technology can provide. I use German implants. I only use original parts in the crowns, and I charge a part of the $900 for the implant, $660 for the crown on the implant, including the prosthetic abutment and the retaining screw. Uh,
Oh,
that is normally done on a separate trip some months later, and well, basically that's it. Normally there is uh, a charge for CT scan or X-rays needed in each case, depending on each case.
mm,
And normally my patients who don't live in Costa Rica, they know the price they have to pay before they come because they send me at least a panoramic X-ray. So that's how we normally work it there. What I want to give them to my Costa Rican patients, they're still most of my patients and my foreign patients, is a treatment as good or better than in any specialty clinic in the world. I know our prices are better than in your country, and I
hmm
respect dentists in your country a lot. Uh, but not only the price is the reason to come here, but the quality of the work and the guarantee that we provide to them.
If the patient needs a follow-up, and years later, you said something lifetime guarantee, do they have to come back down then and see you?
Yes, yes, the guarantee, if something ever failed, they have to come here. And for example, if an implant failed, I always say from now until death do us apart, I will replace it for free.
Have you had many of those kinds of cases?
No, not many. That's the trick. They don't tend to fail. The literature worldwide says 2 to 5% failure. My experience after 24 years is a little less than 1% failure. But yes, implants fail. Anybody that places implants has had failures, and the important is to hold the responsibility for
hmm
that. So yes, I give that guarantee.
Does that include the extraction?
I don't charge for extractions when the implants are going to be placed, basically because the I want to do the extractions myself. I always tell that to the patients. I want to take a lot of care to the bone, and normally we can extract the tooth at the time of implant placement. Most of the times when we pull a tooth, we place the implant. Sometimes it is not possible. In those cases, the patient will have to come probably 3 times to Costa Rica, and that is something they have to calculate. But most of the times, it's 2 trips to our country. Normally, between appointments, our patients will travel to the touristic places. There's volcanoes, rainforest, of course, the ocean, Pacific and Atlantic. You can drive from the Atlantic to the Pacific in 4 hours.
Mhm.
So normally they combine dental with pleasure.
That's what I hear. At least there's some downtime you can enjoy there. A lot of Americans go there. Do you know if there are a lot of Floridians specifically that go there?
Yes, well, it is a 2.5 hour flight to Miami. So and there are like 5 or 6 flights a day. So yes, many of our patients come from Florida. Not only in the south part, also we have patients from Pensacola, from Orlando, from the inner the internal part of the paddle, Tampa, and but we receive from many other states, as far as Alaska. We have had a couple, yes. But yes, from Florida is very simple because it's normally non-stop flight, many offers depending on the time of the year. So we have many from there, and often we have people from Florida that tell us that they come to us because we are their only dentist. So they don't mind flying a couple of hours, and even though they could afford a dentist in any part of the world, they choose us because they trust us.
You've been practicing there for 24 years?
Yes.
Have you seen this trend in dentistry and dental tourism there grow in the
Yes.
last?
Yes. It has. We have done the dental tourism for, well, as a specialist for 20 years already, as a general dentist for 24, and I have been seeing people from abroad for all this time. But it has grown a lot, and more dentists are receiving patients. Of course, I am not the only one, but I always tell people, come to Costa Rica, because it is not only the quality of the professionals here, but the country is a very friendly country. It's a country that lives of tourism, and that receives the patients with the open arms. So, and the patients, not as only as patients, but as tourists.
When people are dealing with their medical situations, or specifically the dental issues, when is it worth it to go there?
I say it's always worth it because of the quality, but money wise, I have learned that for coming just for one implant and its crown is not worth it after the airfare and hotels and taking the time of work and everything. Uh, Two implants are normally worth it. Most of our patients will come for more, but because three and up makes it worth. That's what I understand. I have to say, respect the prices up there. I only uh, say that we charge foreigners the same price we charge Costa Ricans, so we have better price with very good quality. Uh, but the the idea of coming, if the patient all they want is to save, one implant is not worth it. Two are worth it, and three and up is definitely worth it. Most of our patients come here for 6, 5, or 8 implants, and
Wow.
some come for one because what I told you before, they trust us as their dentist, so they want us to do the work. So maybe it's going to cost the same after all the costs of flying here uh, to to have it here, or in the US or Canada. We have a lot of patients from Canada also, but they come because they want us to do it.
When one is looking for a dentist out of another country, abroad, specifically Costa Rica, what do you suggest they do? What's the first step a patient needs to do?
Normally, contact us to our webpage, costaricaimplants.com. And normally they can request a call, and we will call them. If not me, Bill, our treatment coordinator, will call them and try to describe their case. With a description, I can make an approximate estimate, and send a lot of information that they may want to read, including some uh, contacts from U.S. patient of ours that had come here, and they're willing to share their experience. But if later they can send me an X-ray, I can move that approximate estimate to a very accurate estimate before they come, before they take any sorry, decision. So that is what I recommend. Describe as much as they can and send me X-rays.
Okay, very good. And then as far as travel is concerned, does Bill take care of that too?
I let
Hotel.
the patient do it. Yes, I let the patient, I'm sorry, choose. If they want us to book everything, we do it. If you want us to book the hotel or the airplanes, we're glad. Bill will be glad to do it.
Um, what is the big concern? What do people tell you? What is their biggest concern?
No, not many, not many. They uh, probably the concerns they have is inherited from to the dentist, to the professional himself. Is coming to the dentist is not a nice experience, and I always start from that point. So we try to make the experience not that bad. We have many ways to sedate or to relax the patient depending on how deep they want to go. We can go from the relaxation peel to general anesthesia, and in the middle we have laughing gas and eye sedation with the help of a specialist in medical with a specialty in anesthesia. So there are many options to fight the anxiety, and that one is the main anxiety.
Mm.
Also, the other concern that we talk a lot about on the phone before they come is not only taking the decision of coming here, but choosing a dentist, even in your own town, is not easy. Choosing a medic is not easy. Also, so choosing a professional, a health professional in your own town is not easy at all. So choosing one abroad could be a little harder. So
Exactly.
I always say, if you're going to take the decision to come here to Costa Rica with me to receive dental work, I want you to be comfortable with that decision. So I want to send all the information uh, that they will sorry want. I want to I recommend they talk or at least email my patients, and some of them will share their phone number. I cannot provide phone numbers, but they can request on the email, and and this way they will probably will feel more comfortable. They will know more where they're coming. Most of my patients come because they know somebody who has come already, or they know somebody who knows somebody who has come. And but every time more and more, and this may answer your question before, come because they just do an internet research and they just contact us and they come. And some tell me that my friends send me the guinea pig. They want to know how it went with me, and then they will come later and they will come.
That's funny. Anything we need to anything else that we haven't talked about, that maybe something that's not really discussed but you want people to know about?
Yes, well, Costa Rica is a country to be trusted. It's a state of law. It's similar to the U.S. We are a very small country without an army, and coming to San Jose is a nice experience because it's easy to come, and close to the shore, close to the volcano, close to the rainforest. So it's a place to be trusted. Um, I recommend to do the research, to choose a dentist. If not me, choose a specialist. That's what I always recommend. Choose a specialist, hopefully in implants, and ask for a guarantee. That is my recommendation. And see the dentist's experience. And I can recommend uh, places to go, places where or places not to go.
Mm.
And well, it's always each patient is a different world. So some like the huge concrete hotels, some like the ocean meeting the shore, some like to stay in the city. So I try to personalize each experience.
Very good. I think that's great, Dr. Anglada. How do you feel?
Thank you for your time, Jane, and anything you need, just call me.
I
Call me.
will.
I will be glad to answer any question you may have.
This has been awesome. So thank you. I will email you, let you know when we'll, definitely have a date that this will air, and we'll take it from there. But this has been very insightful.
Thank you very much. I hope you have a great experience with this project that you
Yeah, it's been pretty neat.
have. Thank you, Jane. Nice
Okay.
talking.
Nice talking to you.
If
Have a
you
good
want
night.
to make more questions, if you want to repeat it, at this time I am almost always free.
Always free. Okay.
Yeah. If you, I'm noticing I didn't take this.
I
Uh,
see. I was like, you have to
sorry
go
about
home every once in a while, doctor.
that. Thank you very much. And if you want to do anything to repeat it, I will be glad to do it.
Perfect.
Okay?
Thank you so much.
Thank you for your time. Nice talking to you.
Nice talking to you. Take care.
Pleasure. Same ways.
Okay.
Bye.
Bye.